Ciasia Blake first found out her son Cameron would be born with a cleft when she was 5 months pregnant.
At first, they weren't sure of how wide the cleft was, but on the sonogram, it was definite that he had a cleft. I was in a state of shock because I've never seen what one looked like before.
Plastic surgeon Dr. Kaveh Alizadeh says clefts manifest themselves in different ways, ranging from minor to very severe.
A cleft deformity is really a malformation of coming together of the two parts of the face as the child is in the uterus. And that usually happens in a typical time at around 2 months of gestation. And basically what happens is the face, as it's forming, the two sides of the face are coming and meeting in the center part of the face. And anything that disrupt that behavior will prevent this, whether it's the palate or the lips or the nose, or even in deeper scenarios, it could actually be the entire face from coming together.
There are several factors that can cause a cleft deformity.
Different ethnic groups, such as Native Indians, as well as Asian population that have a higher incidence than the rest of the population. But also it could be related to nutrition. There's some research that's shown that nutritional defects can lead to a higher incidence of clefts. And also in certain circumstances, actually mechanical. So if you have a baby that has a very small chin, that small chin would then push the tongue up. And if the tongue is in the way of the face as it's forming in the uterus, it will not allow the face to meet in the midline.
So what does this mean for a child?
Having been involved in cleft care for over 10 years now, it's amazing to see how resilient these children are. And even though they have a very obvious deformity, they grew up, for the most part, pretty healthy, ambitious, wonderful, intelligent kids.
From a medical standpoint, doctors need to make sure children born with cleft deformities are developing the correct speech patterns and getting the nutrition they need.
A child that has a cleft palate is likely going to notice that there's regurgitation of the food or the milk coming through the nose. And also, once they get to the age of 1, a lot of the speech patterns are forming by that time, so they may not be able to form speech properly. And of course, we want to intervene prior to that.
After discovering Cameron's cleft, doctors referred Ciasia to a genetic specialist for counseling.
She tried to convince me to terminate the pregnancy because they weren't sure of how, they knew the cleft was wide, but they weren't sure how wide it was, if it was gonna cause him to have an abnormal nose, because it looked like he didn't have a nose at all.
But Ciasia chose not to terminate the pregnancy.
I was already 5 months into the pregnancy. All this time, you watch your baby grow on sonograms, and it's like, why? You can just get the strength to deal with it.
Cameron was born with both a cleft lip and a cleft palate, but it wasn't as bad as expected.
That was definitely a relief. I was able to feed him because at first I was afraid I would have to feed him through a tube and he would have to stay in the hospital, but they had special bottles and he was able to eat, and he ate a lot.
Ciasia was sent to a cleft palate coordinator who helped her and Cameron meet an array of doctors, including Dr. Alizadeh. Dr. Alizadeh says it's best to seek out a craniofacial center in your area that can put you in touch with the right specialists.
This is actually one of the most interesting disciplines in medicine, in that it really requires at least a dozen different specialties.
It was very overwhelming. It was a lot of doctors, a lot of appointments, but when you went in, they made you comfortable and they gave you a full understanding of what was going on and what needed to happen next.
When Cameron was 4 months old, he had surgery to correct his cleft lip. Several months after that, Cameron underwent another surgery to close his palate.
We always like to do the first stage is the lip and nose because that's more visual and visible, and it's easier as a fix, and also we can do it at a younger age. And then we wait usually around 8 to 9 months of age for the child to grow a little bit more. That way we have more tissue to work with. And we plan that definitely before 1 year of age, because by 1 year of age is when the child is starting to form sounds and does cooing and things like that. They're really experimenting with different sounds.
Now, 5 months later, Cameron is thriving.
He does normal eating out of a cup. He's drinking out of straws, eating all different type of textured food. Before, we had to chop it up. Everything is perfect. He's walking. He has his 2 front teeth that weren't supposed to come in. He's doing a very good job communicating. He's also taking sign language. He's doing marvelous.